And welcome, Ali. So good to have you here.
Hi everyone. Thank you, Shafi and Hani and Bastian. As Ahmed mentioned, fasting is not only a religious obligation, but it's also a social activity that people with diabetes would like to share with their families. And not being able to fast can be emotional and difficult for some people to bear. And as you know, fasting is abstaining from food and drinks from sunrise to sunset, and this depends on your geography, can be 10 hours or 20 hours. And as you know, with diabetes and having insulin on board, risk of hypoglycemia is high, and if people reduce their insulin, risk of high glucose is high as well. So diabetes-related complications can rise significantly during fasting. And IDF has came up with a risk assessment to see how safe is it for the person to fast or not. And people with type 1 diabetes already score high. But still, people who want to fast, we should kind of support them in that respect. And there came up this WhatsApp group for people who are using DIY or commercial artificial pancreas systems who wanted to fast Ramadan, and it was moderated by myself and Dr. Sufyan. And from that data, people kindly donated their data for Ramadan last year, and we've published that. We've shown that the DIY and commercial artificial pancreas systems were enabled people to fast Ramadan safely, and to do that in an easy to achieve way, without a lot of burden with regard to checking blood glucose or having this emotional burden of whether they need to break their fast or whether they will be safe or not. The rate of hypoglycemia during Ramadan was more or less similar to before or after Ramadan, and it was minimal. Time in range was above 85. In fact, it was 88%, which is amazing for a person who is abstaining from food for long periods of time. And at the time of iftar, they are having a substantial meal as well. That would require adequate insulin cover for it. And therefore, risk of hypoglycemia if overdose afterwards is high. So we've shown in the study, which was published recently, a few months back, that it is safe to fast Ramadan, and it can be done. And even people who don't want to fast for religious reasons, they can adopt the approach, whether this is kind of a health approach like the intermittent fasting or not. And the point I would like to comment here is technology is an enabler. We've seen that artificial pancreas enabling people to do things that used to be really challenging and difficult to do. We've seen people doing marathons, doing really challenging sports, deliveries in the hospital, managing their surgeries with artificial pancreas. And now we've demonstrated that artificial pancreas, whether it is commercial or DIY, can enable people to fast for prolonged periods of time and do that safely.
We say Doc Day is an event by and with and for people with diabetes, but I'm so glad that we make exceptions sometimes for people with type F, so friends and family. That's what you are. And it's so amazing to see people who don't have diabetes, but who get it and who see the emotional side of things as well. And it's amazing news that closed loop systems enable people to really practice fasting safely and meaningfully. Thank you so much.
Thank you.